I'm talking to you about eating for blood vessel health. If you think about it, diabetes is a blood vessel disease. People don't die of high or low blood sugar. They die of something that affects their large blood vessels, like their brain or their heart, or their small blood vessels, like their kidneys and their eyes. In talking about eating for blood vessel health, I am not speaking about a different way for eating than the way that anybody should eat. Everybody needs to eat like a diabetic. Everybody needs to eat like a heart patient. These are not opposing diets. They are diets that are very complementary to each other. There are 3 rules that I have for eating for blood vessel health. Number 1, reduce the intake of hard fat. It turns out that our body produces cholesterol much more after we eat hard fat than it does when we eat this poor little egg. After years of thinking that foods that contain cholesterol raise our cholesterol, these foods are generally not responsible. It is hard fats that tell our body to produce excess cholesterol. In addition, when we eat hard fat, we have an immediate inflammatory response, which I'll talk about in just a little bit. Number 2 rule is purposely eat good fats. What I have here is canola oil, but this could also be olive oil. Other ways to get good fats are to add nuts into your diet or fatty fish like salmon. With your doctor's approval, you could take fish oil capsules, which have a huge effect on lowering triglycerides. So purposely add good fat. Number 3 rule would be the intake of soluble fiber. Soluble fiber has an effect of lowering your cholesterol. Examples of soluble fiber would be oatmeal, Cheerios, beans such as baked beans, garbanzo beans, pea soup, bean soup. Other soluble fiber foods are fruits and vegetables. Fruits and vegetables also have a side benefit of lowering our blood pressure. When we're talking about diabetes, there are 3 things that we are looking for. A, lower the A1C, B, blood pressure health, again the fruits and the vegetables, and C, cholesterol, lowering cholesterol and improving the rest of the lipids. Those are the ABCs of eating for diabetes. Remember how I said I'd talk about inflammation? This represents an artery of a person who just ate a 900-calorie McDonald's meal. Now, this is a Big Mac value meal, a sandwich, fries, and a Coke, and it's not even necessarily a large McDonald's meal, but the hard fat that's in meat, the cheese, and actually when I saw the conference, McDonald's French fry oil was that evil, hard trans fat. Hard fat causes immediate inflammation. And this almost looked like pus surrounding a hole. By the way, this person was not diabetic that ate this meal. The same person ate the same meal but added a fruit or a vegetable and had an immediate anti-inflammatory effect. This anti-inflammatory effect also lowered blood pressure. In doing further research and attending more conferences, I actually found what it was in fruits and vegetables that had that anti-inflammatory effect. And it's something called nitrites. Nitrites become nitric oxide. That nitric oxide has a dilation effect similar to nitroglycerin. At the top of the list having nitrite in it is spinach, the other leafy green vegetables, the cruciferous vegetables like broccoli, cauliflower, onions, celery. And then further down the list, the other vegetables, further down the fruits. So having a fruit or a vegetable with a meal, especially if it's a high-fat, hard-fat meal, has an immediate positive effect. Now, I'm not saying that you can eat whatever you want as long as you have some carrots or some spinach leaves with it, but it does add a little bit of sanity to our diet. If we're going to